lab at the University of Salento that is located in Lecce. If you remember the shape of Italy like a boot, we are at the end of the hill, and Lecce is here in the middle of Mediterranean area. And the research activities in the laboratory are focused on the use of extended reality in medicine, surgery, cultural heritage, and education. We have also a small company in the laboratory. The name is XR Technology, and we try to use the prototype of research developed in the lab to be commercialized in using this company. At the beginning was a spin-off. Now it is not anymore a spin-off. But sometimes it's important to have this company, because when the university is not able to extend the contract for the people in very short time, we prefer to the contract with the company in order to maintain people. I don't know here, but in Italy, engineers, if they don't have immediately a new contract, they go away, and it's not a good solution for me. Let me introduce my team. We have the laboratory is divided in two separate laboratories. One is dedicated to the applications in medicine surgery, and these are the people involved in this part of the laboratory. All these are computer science engineers, and only Rocco is physics, and he works in the application of AI in medical field, in particular in medical images. And also this is the division focused on the cultural heritage, and some PhD students, some assistant professor, postdoc, and so on. Okay, let me start with the topic of my presentation. No? What is extended reality? What is augmented virtual reality? No? This picture is very known in the field because it's a Milgram taxonomy, and Milgram, in using these pictures, defined many, many years ago, which is the difference between virtual reality and augmented reality. You see that virtual reality is on the right, the real environment is on the left, very, very far, no? Because they are totally different. But augmented reality is in the middle, but closer to the real environment. Because what means augmented reality technology? What permits this technology? Permits to overlap additional information that could be images, text, different kind of data to the real environment. I will explain better now. Okay, virtual reality. What is the goal? To be immersed in the digital environment built in the computer. You lose any contact with the reality. No? You don't see the reality around you because you wear a helmet, and you can interact in different way with the virtual objects. No? You can touch, you can feel the temperature, the weight, no? If you use specific devices that are called haptic interface, and so on. The important thing is that you lose the connection with the real environment. For this reason, we prefer when the people come in the laboratory to test our application to say, don't move, please, because you don't see the walls, the furniture in the laboratory. It could be very, very dangerous. And, augmented reality. These technologies maintain a relationship with the real world. You continue to see the real world, but the real world are overlapped. Virtual information or digital information, different kind of information. Why? In order to help the user to better perform some task in the real environment. You can see in this picture, for instance, a virtual door that is overlapped on the street, and permits the entrance in virtual environment. This is a very, very interesting application. I didn't talk about that because this application is mainly focused on the cultural heritage. These kind of applications are called virtual portals. What means? Means that here, for instance, I can place a virtual door. It's possible to see the virtual door by means my laptop or by means my phone or tablet. And the door is there, for instance. No, I see the door here, or I see the building here if you are in the large area. And I can go inside. When I cross the door, I am totally immersed in the virtual environment. This permits to do the reconstruction of some areas that doesn't exist anymore. No? Or in the archaeological area, you can see how was that area in the past. You can navigate in this area. We did a reconstruction like this, for instance, for a church was located in a little village close to Lecce, but now the church doesn't exist anymore. In this area, there is a huge parking area, no? But there is just on the floor, there is just an indication that here, many years ago, was a church, was a little church. There, we realized the application and we stored this application on the store. If you download the application, you can go there and to visualize the church in the real size exactly how it was in the past. You can navigate inside the church. This is an example of these applications. What is the mixed reality? Mixed reality is very close to augmented reality. The difference is that the idea is to acquire information about the real environment, no? In order to know where is the table, floor, a ceiling, walls. Sorry for my cow. I have water. And the idea is to place the virtual objects correctly in the real environment. On the table, not down or in the middle, for instance, because the application at the beginning scans the real environment in order to know exactly where is located the table. And this has done many times because the user can move in the real environment in order to acquire information about the environment, to place in the correct way the virtual objects, for instance. Let me focus attention on an example of the difference between augmented reality and mixed reality. For instance, you have a virtual ball on this table, no? And you know that it's possible to interact with the virtual objects. I can decide to move the virtual ball, no? The ball is moving on the table. When I arrive at the end of the table, if you are in an augmented reality application that doesn't know that there is a table in the reality, the ball continues in this way, don't fall down, no? This is the idea, because no information about the table. In a mixed reality application, the ball, when arrive at the end of the table, fall down because the application has information about the table, when the table will finish, and for this reason, the physics law can be applied in the best way. This is the difference between augmented and virtual reality. You can see also the helmet are totally different, no? Because in virtual reality, the helmet covers your eyes. In augmented reality or mixed reality, there are some semi-transparent lens and you can see with your eyes the real environment around you. All these technologies, virtual, augmented, mixed reality, are called extended reality. It's an umbrella terms that includes all these technologies. And the idea is to create an environment where it's difficult to recognize which is real and which is digital, virtual, no? And the user can interact in the same way with the virtual objects and the real ones. This is the main idea of this technology that is quite new, no? What means new? We started to talk about extended reality about 3-4 years ago, no? And for instance, the association of virtual reality, that is, the name is EuroVR, no, changed about 3 years ago the name in EuroXR, because now we are not talking of virtual, augmented or mixed reality, but we are used to talk on extended reality. I decided to change also the name of my laboratory. The name is Augmented Virtual Reality, but at the end I decided to maintain the whole name because we have our history, and in that way it looks a new laboratory, but the laboratory exists from 2010. No? And just 1 second to drink a bit. Okay, how these technologies can be combined with other technologies, for instance, artificial intelligence. This name was coined many years ago, in 1956, no, by this man with the red shirt. Why now? If it's so old, this technology, why now, or 2 years ago, we started to talk about the artificial intelligence? Simple, because now we have the very powerful computers, no? We have a huge amount of data. All the application of artificial intelligence need a lot of data. And we have better algorithms like deep learning, for instance. And this is the reason why after about 70 years, now we are talking continuously about the use of this technology in several fields, in different fields. And can be extended reality and also the artificial intelligence used in order to improve the performances in surgery or in medicine in general? I think so, because during the life, the doctors study in order to acquire information about the body, about the pathologies, about the treatments. They can visit a patient in order to understand which could be the pathology, the disease, and they act in order to treat this pathology. And in all these steps, is important the use of extended and artificial intelligence technologies. In the last century, there was a very high improvement in the acquisition of the medical images. There is the possibility to see inside the patient's body without opening the body. And it's possible to have collaborative virtual environments in order to discuss with the colleagues about the pathology, and it's possible to acquire images during the real surgical procedure. And also this technology permits to improve learning of the students in medicine. And also in the last year, we moved to minimally invasive surgery. That means not cut the body, but just to create some ports to go inside with the surgical tools and with the camera in order to have a lot of advantages. You can see here the advantages, but also there are a lot of limitations for the surgeon because he has to able to coordinate. During this kind of procedure, the body of patient is here, but it's not important to see the body. The doctor uses to see on the screen, because on the screen there are information obtained by means of the camera inside the body. And it means that you have coordinate hands and eye in order to do in the best way this surgical procedure. That means that the doctors need very long training in a safe environment, like using the virtual simulators. In many hospitals now are used these simulators to perform training and to learn in the best way, this surgical procedure. This procedure can be learned by repetition. It's important to try many times the same surgical procedure, but it's important also to learn which could be the behavior of the doctor if something's unexpected will happen. If they cut an artery, for instance, they are able to repair immediately, and it's possible to perform training in this specific case without any risk for the patient in the virtual simulators. You can see here a typical application of virtual reality for training, and this is an application of mixed reality during the real surgical procedure. That means overlap the models of the organs on the patient body. And these technologies can be used to improve the diagnosis, to plan the surgical procedure, and to perform training. And we can say that medicine meets extended reality. How we can build this application? We need the medical images of the patients, that could be MRI or CT, and starting from this data set of images, that are a lot of images in 2 dimensions and in gray levels, we process these images in order to build the 3-dimensional models of the organ, like this picture. You can see, starting of 2-dimensional images, we are able to build a 3D model, and by means of some segmentation and classification algorithms. And the 3D model of the patient body is the first step every time in all our applications. Then, when we have the model, we can decide this model is built as a sort of puzzle with many different pieces. The pieces are the different organs that are in the gray level, different level of gray. Usually, the algorithms used for the segmentation are based on the region growing algorithm. This, for instance, is liver. We start with this point, that is liver, and we try to increase the area of the liver with the same value, gray level, around the first point, until the border of the liver. In that way, we have for each slide the segmentation of the organ, and using the segmentation, we built 3-dimensional models of the organ. And when we have the organ built in this way, we can decide, for instance, to change the transparency. The skin, the muscles are not important for us. We want to see inside. Or we can completely hide one organ in order to interact, to check, for instance, if the tumor is attached also to the vein or to the artery, to study, to plan the best way the surgical procedure. And we develop a lot of these applications. And these are some benefits of the extended reality, to have a realistic training, but also the virtual reality in particular is used in the pain therapy. What means during specific treatment, the patient use an helmet for VR in order to be immersed in a safe, quiet environment. Could be a beach, the forest, And our brain forget that we are in the hospital, we are receiving a treatment, And In that way, the anxiety of the patient can be reduced, and it's not necessary to use some drugs in order to be sure that the patient is quiet, And in particular, this application works perfectly with the children, And I will show you an application that we developed in the hospital in my town. In US, this kind of application, pain therapy based on VR, is used in a lot of hospitals. And also about the medical application, it's important to perform training without any risk for the patient, because the traditional training methods are not up to the challenges of educating surgeons. And you can see that in this picture, the user, the student, is using this device, a specific device, the haptic device that permits to provide a sort of force feedback to the hand of the trainee. What means, for instance, with the surgical tool, when I touch a digital copy of the liver, of the organ, I feel the contact, and the contact can be modeled according to the behavior of the specific organ. Liver is different from bones, from artery, from kidney, for instance, but we have a lot of information in literature in order to modelize these organs in the best way. And the force feedback is very important to have a very, very realistic training. Not all the simulators, the commercial simulators that are at the moment provide the force feedback, because it means to have a very complex system. But we prefer, in application that we develop in BioLab, we prefer to have a force feedback, and also we use the medical image of the specific patient. The commercial simulator has the virtual environment, general virtual environment, general organs, not of the specific patient. In our application, we include the models of the organs of the specific patient that the doctor will operate in the next days, in order to have patient-based training, not general training on the specific surgical procedure. This is an example of commercial simulator, Lab Mentor 2. You can see that exactly the same medical tools are inserted in this box, and the virtual model of the organs is visualized on the screen. And this is the model of the simulator that combine also some tools, some modules in order to have a correct physical modeling of the organs. In order to have realistic deformation of the organs. In general, we use some methods. The most used is mass spring damper, that is very simple to implement. Is not heavy in terms of computational time, but in some cases we use the finite element methods that is more heavy in terms of computational time, but with the computer that we have at the moment, this is not a problem. In the past it was a problem, but not now. This is an example of a surgical simulator.
You'll see me in virtual space. You can see, here's my head, and I have hands, fully functional hands. I can use all my appendages. You can see that. I can also use them to grab these tools over here, like this pin driver, and pull triggers. This, okay. So this is our surgical environment you can see here. There's a couple of things we've done. We've branded to the Ghost Productions logo, and I'm also in what's called VR, so I can walk around the patient. I can walk up to the patient's head. Hey, patient. Make sure they're still alive. Are you alive? And I can walk around the other side of these tools over to the other side of the patient too. Here we are. And into the microphone. Sorry, everybody. Okay. And the first thing I'm going to do is put the knee into 90 degrees of flexion. So I'll grab the ankle here. I'm given a highlight to help me see the goal where I want to put this leg.
To highlight the goal position for the patient leg, no?
So we have it 90 degrees of flexion. I'm going to select a scalpel from the Mayo stand. And now I can see that there's a highlight to help me know where to start my incision. It's also a line down the midline of the patella to tell me where I should make this incision. So go ahead.
The scalpel to make the incision starting just above the patella.
Okay, so we have the incision made. Now, one of the things we worked really hard on was to develop a soft tissue deformation system so that the user can interact with the skin's incision margins with their fingers and manipulate it to help the user feel like a more immersive experience, to have flesh reacting to our touch as users. I also have a few tools on the Mayo stand I can use to manipulate the soft tissue finger retractors. For this demo, I'm going to use these forceps retractors, and they're fully functional. I can squeeze them and open them up here. So I'm going to place them in the incision and retract it.
Select the scalpel from the Mayo stand.
You can see that all the different steps are visualized, and many of these system application for training are built like a serious game, no? What means that some parameters are considered in order to provide at the end of the training session a sort of score that could be time, precision, many different parameters. And this is important in order to permit to the doctor to compare the different training sessions, no, to understand if he improved the skills, no, or not, no, which could be the changes in terms of time or in terms of precision, in terms of movements, no. For instance, we realize an application where inside the body we measure the movements of the tools inside the body, no? Because an expert, a doctor, doesn't move in that way, no? Because there are enough space there, just little movements, no? And this is also a parameter that we consider in the final score, the time, how was deep the cut or not, many parameters considering the specific surgical procedure. Okay, also in the emergency training is very important because in short time they have to take some decision, and the anxiety, the stress is very high in that situation. When the patient arrives and the doctor knows that the life of the patient is in a ends, no? And it's very important to understand which are the best step, which is the standard step that they have to follow in order to provide assistance to them in these specific situations. What about the augmented reality? I told you that augmented reality permits to overlap virtual organs on the real ones. These are the real organs. I scan these organs, I have the medical images, I built three-dimensional models of the organ, and we have to overlap the virtual organs perfectly on the real ones. Why? Because the doctor in minimally invasive surgery is not able to see all the organs. He is able to visualize just a small area around the camera. But if he is able to visualize the virtual organs, he knows that where there are the virtual organs, exactly there are the real ones. he can proceed in the best way. But the overlapping is very important. The doctor, the surgeon say us that the maximum error in this overlapping is 3 millimeters. If the error is higher, we don't help the doctor, because we say, for instance, that the artery is there, but is not exactly there, and he can do some mistakes in that case. And the idea of the augmented reality in surgery is provide a sort of X-ray vision, like Superman, inside the patient body, no? And of course, we have a lot of limitations, no? The overlapping has to be very precise. In addition, the breathing, the movements of the organ due to the breathing has to be considered. Some organs are not fixed in the body, like intestine. No, this technology cannot be applied to the intestine. No, but to the organs like liver, kidney, bones, brain. No problem about that. In which way we overlap virtual organs on the real ones? Our algorithms, registration algorithms, are based on fiducial points. We choose some fiducial points before scanning the patient body, no? And we mark with a special ink these points in order to visualize the points after 1 week when the patient will be operated. And using an optical tracker like this, and some reflective spheres like this that are applied to the surgical tool to the patients, we overlap the virtual organs on the real ones. No? And we develop a lot of these applications, starting from which is the 2019, we started to develop these applications. In particular, we worked on the treatment of the tumor to the liver, and we developed a specific application that we tested in the operative theater in an hospital very close to in our region. You can see here, let me stop this. Okay, you can see here the tracker, the optical tracker. You can see here the tool, the surgical tool. There was the real patient in this test. The surgical tool, on the surgical tool, there are some reflective spheres, and the tracker, the cameras of the tracker are able to localize this sphere to know exactly the position of the tool inside the patient's body. And the idea is in this treatment to reach the tumor. This is the tumor. This is the ablator. To reach the tumor, extract these hanks on the top of the ablator, and to destroy for hyperthermia the cells around the tip of the ablator. All the tumor, also a small area around the tumor, to be sure that all the tumoral cells are destroyed. No? This is the problem, because the doctor, when the tumor is deep in the liver, is little, is not simple to reach in this way, to be so precise. Consider that in the liver there are a lot of veins, a lot of arteries, and the doctor has to find the right way, avoiding to cut arteries or veins. And sometimes this is a tumor, and the doctor arrives here. No? That means us to destroy a large area to be sure to destroy the tumor. And this is not the best for patients that are cirrhotic, and to destroy also not necessary cells, healthy cells of the liver could be dangerous. And for this reason, we realize this application in order to guide the doctor during the surgical procedure. I'm here. I try to take some pictures, and here are some boys of the team And at the end of this procedure, at the end of this test, the doctor said us, using the augmented reality in this kind of application is very important, because it's like to drive the car with the GPS navigator, because we know exactly where we are inside the patient body, and we know exactly what there is around the surgical tool. Many years ago, we did this test. Later, we decided to change the tracker, because the tracker here is not the best position, because if this surgeon is in the middle between the tracker and the tool is not detected. No? And for this reason, we decided to use 4 cameras on the top of the bed, in order to be sure that every time the surgical tools are detected. After that, at that time, there wasn't the HoloLens. Later arrived the HoloLens. No? I don't know if you tried the HoloLens. HoloLens the first version is this, and this is the second one. It's an excellent helmet developed from Microsoft, and is able to recognize some gesture in the front of the helmet. It is also voice recognition. If you have an excellent English, American English is better, the HoloLens is able to understand your vocal your voice, no? Let me show you this video, and in order to understand how can change the learning in medicine using systems like that. Gestures are recognized, no? Specific gestures, and transformed in tasks. This is very impressive. Table is true, hand is true, the patient is virtual. No? We can scan the patient using our hands. All this to study and to use also this technology. Okay. But if you check in internet using the use of the HoloLens in surgery, you will find a lot of research group that used HoloLens, no? But in particular, in London, one the university, the Imperial College of London, worked with the St. Mary's Hospital, and they applied these technologies to a specific case in the vascular surgery, in order to visualize on the real patient leg all the arteries, veins, bones, and so on, no? In order to help the surgeon during the surgical procedure. And was interesting the use of this technology. But some years later, the University of Pisa in Italy, with many other research groups and companies, in the VOSTARS project, the European project, they demonstrate that the HoloLens is not good in surgery, because if the distance between the helmet and the patient, in that case, is less than 50 centimeters, like when the doctor operates the patient, the error in the overlapping could be very high. And they demonstrate that. And for this reason, they realized a new helmet specific for surgery, and they tested the maxillofacial surgery. And this helmet was, if you go in this website, was very interesting. In this picture, in this video, you can see the first prototype that they realized in this project in order to visualize virtual information to perform in the best way this surgical procedure. And the many members were involved in this project. I tested this helmet, this first prototype, that is very interesting. But I don't have information about the commercialization of this helmet at the moment. It's my fault. I don't know if they realize a commercial helmet in order to specialize in the surgical procedure. Okay, and the artificial intelligence can help the doctor during the surgical procedure. The first application that we have, very interesting, was realized from some research, Japanese research in 2021, and they collected a lot of data, a lot of information, and they realized an application to define the safe dissection plan in the surgical field. What means? Means that during the real surgical procedure, they define and they were able to visualize exactly where the doctor can cut the organ in order to proceed in the surgical procedure. They overlap this. It was a first prototype, a first example of this application during the real surgical procedure, in real time, you know. This was realized from this university in Japan. Very interesting use of this technology. In my lab, we realized last year another project, very interesting, where combined radiomics and artificial intelligence. In which way? Was a project for the treatment of the tumor to the prostate. No? And we realized this application that we'll describe later using the radiomics. What means to have medical images, like in the treatment of the tumor to the prostate, MRI images. No? We have these images. We try to extract some features from these images. We select the specific feature, and then we transform images in numbers, no? In that way. These are the steps, no? Imaging, segmentation, extraction of a feature, analyze, and transform the images in numbers. This is very important because in that way we can apply some algorithms to these numbers in order to classify the organ, to check exactly is it tumoral cells or not. This was our goal, to find a way to know if the patient has a tumor to the prostate, consider if there is a tumor, the doctor, the surgeons take off the prostate. It's very small. But in this procedure, they sometimes, very frequently, they cut some nerves. They cut some arteries. That means that the problem of the tumor is solved. But the patients will have a lot of problems later in terms of erection, for instance, no? And it could be very important to know if it's necessary, the surgery or not. Because at the moment, the doctor prefers to take off the prostate in order to solve the problem. And we used these technologies in this project RA4 Pro, that is augmented reality to support the diagnosis and surgical treatment of prostate cancer, where we used the ultrasound images. This is very interesting. At the moment, the doctor uses the ultrasounds and they have a suspect about the tumor, and then to be sure they need the MRI images. But in our hospitals, to have the MRI images, we have to wait many days, in some cases months. No, that is the problem, because the tumor doesn't wait for us. No, and for this reason, the idea was to use the ultrasound images in order to be able to acquire the same information that we can obtain by means of the MRI images. And in this project, we proved that this was possible. And we used we integrate imaging, AI, VR, AR, no, in order to for the treatment of the prostate, in particular for the biopsy, or nerve-sparing robot-assisted prostatectomy, no? Because this procedure is done usually by means of the Da Vinci robot, surgical robot. And we combine these technologies in order to have a correct interpretation of the ultrasound images. Sorry for my cow. It was the weather in Sevilla, because it was 2 days ago, it was very hot, and yesterday the temperature fell down. No? Sorry for that. And we work on this to use them ultrasound images in order to obtain the same information obtained by means of MRI. Unfortunately, in the project, we did the preliminary test using only 18 patients that are not so big number. Now we have to increase the number of patients, but in the project, we didn't have enough time to do that. But we are writing a new European project in which we want to investigate more in detail about this, the use of this technology. The hypothesis was the analysis of the transrectal ultrasound images can permit to extract information like MRI. And the clinical question is, can the ultrasound images permits to say exactly that area is tumor or not? No, and we worked on that. We realized also in this project a preoperative module in order to permit to the doctor to plan in the best way, using the information obtained by means of the MRI images and the reconstruction of the organs, to plan in the best way the surgical procedure. We developed an application of augmented reality, and we used this helmet, Magic Leap, that is a helmet that is, it's not correct to say artificial intelligence, augmented reality, because this is mixed reality. And but this helmet is certified for medical application. For this reason, we use this. We use some markers detected by means of this helmet or detected by means of an optical tracker, and we did some tests on a mannequin in the laboratory. And we also developed an application of this technology during the real surgical procedure in cooperation with the doctor using the Da Vinci robot. Very, very interesting, this project, and that the use of this technology permit to preserve some anatomical structure, nerve sparing in particular, no? that are important for urinary continence and erectile functions. And also, it's important to reduce the time of the surgical procedure and to be very, very precise to minimize the complications that the patient can have after the surgical procedure. This project, I have time to talk. Yeah, I can continue. 15 minutes more, it could be enough or too much.
No, it's okay.
Okay, this is a totally different project, Little Prince project that we develop in our hospital. We develop an application in order to have better conditions for the children in the hospital. No, it's not applied to the surgery, but is applied to well-being. No, the children that are in the hospital, in the oncohematology district of the hospital, they stay alone there, and the idea was to use the VR in order to permit to have, we develop an application for mobile and using this cardboard, this paper helmet, you put the mobile inside, and it's possible to visit the division before going there, no? And in that way, the patient will know which will be the area, the rooms, the environment before going to the hospital. And in addition, we developed an augmented reality application. We used some images that we applied on the floor, or we animate also the picture on the walls in order to permit to have some games, treasure hunt, some games during the hospital. They stay all day alone in the hospital because the visits as possible for patients, for parents, but consider that these patients have a very low defense, no, due to the treatment, to the chemio, and for this reason they cannot stay with the friends, for instance, in the hospital. The idea was to develop this application, to develop a collaborative virtual environment. They wear helmet, the patient, the nurse, the doctor are immersed in a virtual environment. They can play there. They forget to be in the hospital. No, this was very, very important, and also the pain therapy that I told you before. And let me show you a little video about that. We prefer to use just one controller because you can see that usually they have the AGO. What is the name of AGO? Is needle in the artery. Huh? Okay, you have an idea how it could be different to stay there using this technology. We also use the robot Pepper that we had in the lab and that we programmed in order to go around in this department. And this is nice. They say bye-bye, no? Because the sense of presence in the real environment is very high. They forgot to stay in the hospital. The idea is the illusion to be in that environment, not in the environment, in the hospital environment. Okay, last part is about the digital twin. We are working strongly on the use of this technology in medicine. Now, what means digital twin? Twin, you know, that is the copy of the virtual, the real object. No, I can model this bottle, for instance, and they have a copy. But if the temperature of the bottle change, the evaporation on the pressure, change some things, our copy is not realistic because the real object changed. But if I apply some sensors to the bottle in order to monitoring real-time situation, and this the data coming from this sensor, I use it to update the virtual copy, we have a copy that is every time realistic. This is very important. Digital twins are applied in many different fields. We are applying in cultural heritage, where the frescoes of, for instance, in the church is very important to know the condition of humidity, temperature, pollution, in order to avoid the frescoes or the monuments in general can be destroyed. And we are applying in medicine. We applied to the Parkinson in order to predict in time the evolution of the treatment. Which are the technology involved? Internet of Things, because we need a lot of sensors. Cloud computing, because the data coming from this sensor has to store it in some place on the cloud. Extended reality in order to have some simulations, and artificial intelligence in order to predict in time some situation using the data that we acquired and to avoid some things about to avoid the strange situation, dangerous situation will happen. We need a lot of data. You know that all these applications work the right way if you have a huge amount of different data. In medicine, this technology is very important in order to have personalized medicine. All of us have a liver, but my liver probably is different in size or in behavior or resistance to the drugs, for your livers. And in that way, we have a personalized medicine, predictive medicine, and precision medicine. These are the three goals of the digital twin in medicine. At the moment, many research groups are working on these technologies. Just there is an application developed about heart. Living heart was realized from this company. This company in cooperation with Philips, and but is a new research field in medicine. And also we are strongly work on the virtual humans, virtual characters, conversational avatars that could be used in many, many different fields. We developed some conversational avatars in the hospital, for instance, could be the interface with the patient, between the patient and the district, the department. And we realized these virtual humans for the radiology department, and our virtual human is able to interact, is able to understand the question of the user, and is to be trained on specific data of the specific department. It is able to reply, to print on the printer information, or to interact with the computer that is inside the district. It's very, very sophisticated. And now we are working a lot, and each virtual human has a body that is an aesthetic problem. We can wear in this way or in different way. If we use in cultural heritage, for instance, we can dress we can use different dresses, for instance, according to the specific environment. But the important thing is the mind, the behavior, the training, how the virtual human could be able to understand and reply in the correct way. We avoid to permit to the virtual human to go in internet. because in the radiologist department, the virtual human can go in internet to find information about the radiology department in the hospital of New York, for instance, provide information about that. We train we are used to train the virtual human on specific data coming from the department that are specialized for the specific department. And of course, the AI technology, LLM, are used in many of these applications. And we are using the huge project for autism, in order to try to detect in time some in time some strange situation, because the little patient wears some non-invasive sensors in order to acquire information about the body, temperature, heart rate, humidity of the skin. And also there are some sensors in the environment to verify, to check the movements, the frequency of the movements. The children with autism are used to do many movements and the frequency of the movements is higher. That means that the crisis is very close, And we use all this information to permit to the virtual human to modify also the environment condition, or the change the interaction, with the patient, to have a sort of empathy with the patient. And we use the Convai, that is a cloud-based conversational AI platform in this specific application. And the last is about the Michelangelo effect, that this is strange. In this paper, the colleagues proved that when a person is in front of a very nice picture, la Gioconda di Leonardo, I don't know, la Primavera del Botticelli, in our brain are activated some area, a lot of areas, but in particular are activated some areas dedicated to movements. It's strange. Why? If I have in front of Gioconda, I activate some area specific for the movements. But it's true. And we used this activation in order to have rehabilitation that is could be better. The movements could be done in the best way, or the fatigue of the patient during the rehabilitation is low, And we applied this technology in cooperation with an hospital in Milano for the hand apraxia. We realized this application and we verified that it is better to use this technology combined with the due to the Michelangelo effect. And then the last slides, there are information about these events. In particular, the XR Salento is a conference that is every time the Salento area. Salento area is the last part of Apulia region where is located Lecce. Is the name also of my faculty, of my university. And this year will be in Otranto, on the Adriatic coast of Apulia region. And the conference, if you go in the website, you can see that here you can find the topics of this conference that are virtual. You don't see, sorry, you don't see. I don't know why. Okay, the topics.
Presentation mode is...
Okay, no problem. Topics are extended reality, artificial intelligence applied in different fields. And also, there is a summer school that we organized in the last years in Italy, but this year, for the first time, we moved in Greece, in Thessaloniki, was also a summer school or extended reality, but now it's difficult to talk just about one technology. In many, many applications, there are many technologies combined, and artificial intelligence is one of these. Okay, this was my last slide. Thank you for your attention. Thanks a lot. And sorry for my mouth.
Okay, we have some questions. I just wanted to repeat the thanks. And, you are.
If I will be able to reply.
Thank you very much.
A virtual reply.
Okay, my avatar will reply.
Yeah, sure. Thank you very much for your presentation. I think it's very interesting by itself, the field of extended reality, but mostly because it's applied to medicine, because I think it's crucial to try to improve the behavior.
The performance of the surgeons.
It's amazing. I wanted to ask you because I love the field of virtual reality, both in research and non-research, like in games and so on. So I know that maybe 10 years ago or so, there was like a boom of virtual reality because many different headsets, either Valve or Microsoft, they came out with new headsets. But after that, there was like a winter of virtual reality and so on.
Yeah.
Also, Apple with
Apple Vision Pro.
The Apple Vision Pro, they tried again to come with the augmented reality thing. But after that, there was not so much. From the point of view of the general public, there was not such amazing discoveries, let's say. But I don't know how is the market in the research field. Like, are there new advancements in this area apart from the applications? Are there new, I don't know, for instance, you talk about haptic devices, and also you presented in the HoloLens thing that it read in some sense the movement of the hands. Is it precise right now? Because maybe instead of using these handsets, let's say, or controllers, maybe it would be interesting to have like I remember there was some haptic gloves that even could restrict your movement if it simulated that you were having something in your hand. Have you tried or have you thought about this type of application?
Let me say just about my history. I started to work after degree in a research laboratory in Pisa. I took the degree in Pisa. This laboratory was in the Scuola Sant'Anna of Pisa. It is one of the most advanced. There is the first in Italy about robotics, the second in Europe, and the seventh around the world, in the developing of application of robotics. And I worked of robotic arm for patient, robotic hand, and in particular I work in the glove for virtual reality, because the idea at that time, unfortunately many years ago, was about to do the rehabilitation in the virtual gym, using this device. And I know perfectly what is the problem to realize a new glove or new system in order to provide force feedback. In my lab, we use a very advanced haptic device developed from Aption, that is a French company, and we realized an application in industrial field for about the maintenance of the military airplane. But this device is a very excellent device, but very expensive. 80,000 euro for this device that at home is possible to have. You know? No, but about the helmet, of course, HoloLens or Apple Vision Pro are very, very expensive. You know? But there are some helmets cheaper, much cheaper than these, like Meta Quest 2 or 3. 2 is not produced, but 3 is very good. And the cost is a bit more of 500 euro. No? And it's true, you said, 10 years ago when we had the Oculus Rift, no? They started to have a lot of application, and also Meta bought Oculus and realized Meta Quest 2 or Meta Quest 3 at the moment. It is an excellent robot. And for this robot, it's possible to avoid to use the controllers and is able to recognize your hand. And you have a very realistic interaction because your hand are visualized, are detected, and you can interact with the virtual objects using your hand. That in particular, in medicine, for some patients, is difficult to say use the controller, no? And for Parkinson, for instance, it's difficult to say. But it's true that at the moment, the enthusiasm about this technology that we had 10 years ago fell down a bit. But now the idea is to combine this technology. There are a lot of applications that combine XR and artificial intelligence, for instance, in several fields. Yeah.
Also, concerning you were talking about robotics, but I was thinking about that because maybe if you can control in some sense with if the surgeon can control a robot that can go even deeper, let's say, than the surgeon, maybe it's interesting to have an assistant robot that can help the.
Yes. Very important, not only for training, but also during the real surgical procedure. And to visualize, which area could be the best area, where is located exactly the tumor, where I have to cut to remove the tumor, avoiding some nerves, some arteries, And in real time, data acquired are to process it in order to update the visualization. This is the goal of the research at the moment. And but there are, I told you that we have a small company, We had a lot of requests of use of these technologies. We are small, we are not so big, we are not Apple or Microsoft. But at the moment, we have a lot of requests about the use of these technologies, in particular in cultural heritage. In Italy, a lot of requests to visualize what is not possible to visualize, to provide information to expert user, but also to normal people that don't need very important details, but they want to understand the situation, want to understand how was the area in the past. They go in the archaeological area, they are able to see some columns, but it's very hard to imagine how was the area in the past. And using one helmet, you immediately understand. You don't need to be an expert, And it's incredible for children. They are very able to understand. We realize an application for people, for children with ADHD, that is attention deficit and hyperactivity. And we tested this application for several months in a center in Naples, close to Naples. And it was impressive how these children was able to understand the use of HoloLens or other devices in few minutes. But it was very hard to learn to the therapist the use of this system.
The neuroplasticity is
Yes, yeah. And it's very, very, very strange. This is very, very important. Yeah.
Thank you very much.
Thank you.
Okay, thanks. Any more questions? Or okay, so then maybe we finish the session because also I
was too late.
I have the room. No, I have the room up to 11 because
Okay.
I thought maybe discussion time or so. It's okay. We are almost exactly on time. So thank you very much once again.
Thank you to you, Agustin. Let me say just one thing more. The importance for me of this kind of visit is to better know each other and to have the possibility to submit some project, European project together, to work together. This is in my opinion, is one of the best goals of these visits. Because you saw that we are 15 in the laboratory, but just a few of us are stable in the university in terms of that payment of the salary. A lot of these people, they receive for several years the salary, but the reason was that we were able to submit new project proposal, to be accepted, to receive money, to pay these boys that are excellent. They trusted in the research, and decide to stay in the laboratory, to avoid to go in the company, because it was very simple to move in a company, because the company accept a lot of engineers. And the cooperation could be very important to submit new project proposal. For instance, I told you, Agustin, that one of these boy is a PhD student in co-tutela with the University Polytechnic of Valencia, and because we have a strong cooperation with this university. And also we can do the same. The University of Valencia don't pay the salary for these PhD students. I pay the salary with my project, but it's important for me to have this kind of operation, to stay some months in Valencia, some in Lecce, and I receive a lot of students, researchers from the university in the laboratory. In July, for instance, will be 8 students coming from Riga University. They stay every day in the laboratory to work together with the team. This is very important. We have to think and we have to find a way to cooperate. I hope it.
Yes, I think there are several colleagues in the school that could be interested because some people work, for example, in wearables or rehabilitations, so I think they might be interested in.
Also, we are starting to investigate the use of brain-computer interface, for instance, when you are immersed in the virtual environment, to obtain information about the immersion or how your brain realizes that you are in the virtual environment, for instance. Yeah, I'm sure that we find a way to cooperate. Thank you.